Dada,
Hey, what's up, Papa?
what does your heart do?
Oh, your heart. Your heart is like a hollow muscle. It's got some gaps inside, right? So it's a muscle that is bringing in blood from your systemic circulation that's deoxygenated, primarily from the superior and inferior vena cava. And then it's important for students to understand the following. I just remembered right now. Venous blood flow is not based off of the contraction of the heart. It requires muscle contraction and even respiratory effort as the breathing pressure changes in the thoracic cavity. That's what feeds the veins to push the blood back to where it's supposed to go. Of course, in the heart, you call it pulmonary arteries, but I'll digress. So the heart is supposed to pump blood. It brings in blood that's deoxygenated from the right side, and it goes from the right atrium to through the tricuspid valves to the right ventricle, and then it goes to via the pulmonary segmental valve into the pulmonary artery. Then it goes to the pulmonary circulation, and it goes back oxygenated via the pulmonary veins to the left side of the heart. It enters the left atrium, then it goes down the bicuspid or mitral valve. It goes in the left ventricle. Then the left ventricle contracts and it pumps blood out through the aortic segmental valve, and then out to the aorta and through the systemic circulation. So the heart's really important because that's what pumps blood throughout your whole body, up your carotid arteries to your brain, to your arms, to your feet, everywhere. That's how you feel your pulses. And in the heart itself too, it's important to know that the heart itself has blood vessels that supply the myocardium, the thickest part of the heart muscle, which is the heart pump, with blood. So when people eat a lot of cheeseburgers, or when they smoke a lot of cigarettes, or they have like a bad lifestyle, their coronary arteries develop plaque buildup, cholesterol, atherosclerotic plaque, and that limits the perfusion of the blood flow to the myocardium, which eventually will cause angina, that's chest pain, and eventually, if we don't do anything about that, you'll develop a complete obstruction, and that will cause a myocardial infarction, or what we call a heart attack, Papa. And that's what the heart does good, and of course, what could happen to it as it doesn't do good stuff.
Thanks, Dada.